And the final category for the 2010 Health and Social Care Awards is Service Improvement. This award will focus on a team or service that can demonstrate a transformational improvement to any service already in place across primary care and the range of health and social care services. And the finalists are East Lancashire Hospital NHS Trust and their physiotherapy service, NHS Bolton and their Neurology Long-Term Conditions Project, NHS Tameside and Glossop and their MSK Podiatry Service. Let's have a look at these final nominations.
The low back pain drop-in clinics have been developed within the physiotherapy services, and the reason for the development was as a result of having problems with long waiting times with access to physiotherapy for patients with low back pain. The previous waiting times for access to service was approximately 20 weeks, which we were quite concerned about. As a result of the drop-in clinics, the waiting times have changed considerably. Patients can go to the GP on the same day and then refer directly into the clinic within the same week, so they can virtually have access either the same day or the same week into the service.
Very early on in their presentation of low back pain, they can call in at the drop-in clinic. There's no appointment required, and they can come in at their convenience. When they arrive, they come in and give their name to the receptionist on the desk, and she takes some details, and then they're given a questionnaire to fill out. They fill out a body chart which explains like a map of their bodily symptoms, and they also fill out questionnaires which help us to screen them for signs of psychosocial distress and anxiety. And if we can pick those up very early on in the patient's presentation, it means that we can then address those issues early on. One thing that it helped to reduce is the number of patients that are being referred for costly diagnostic tests that don't actually need them, which may have previously happened. If they were on a long waiting list, the GP might have sent them off for alternative tests or other services while they were waiting for physiotherapy, but it stopped that, so there's no duplication of services. So patients seem very happy with that.
The benefits for the service users are that they have access to the drop-in services across the 5 sites, so they can access any of the drop-in services, and then it's up to themselves where they actually access the treatment from following the drop-in clinics. So it's providing them with prompt early access and then a choice of where they require the treatment from afterwards.
I got diagnosed with a slip disc by my doctor. He gave me physio referral, and within 3 weeks of that appointment with my doctor, I'd had a drop-in session here and 2 visits with a physiotherapist. I came in on a Tuesday morning. I was seen within 20 minutes of turning up at the inquiry desk. After that, I spent 20 minutes with one of the physios who gave me some good advice, and it was then we discussed about how we want to proceed, and got some very good advice and some good help.
Historically, the neurology services in Bolton, as in many places, have had long waiting lists. The commissioners and providers of the service needed to respond to the government initiatives to drive down waiting lists and to provide integrated care for patients with neurological conditions. Because of that, they had a stakeholder event with all representatives from the user and carer groups and all the service providers, and went away and formulated a plan and a vision of what would be best for the patients of Bolton who have long-term neurological conditions. So the new service linked in with a service that Salford was providing, as in they provide the acute diagnostic services for neurology for themselves and now for a range of areas around Greater Manchester. Bolton commissioned the diagnostic side from Salford and brought in the consultants' time to link in with all the therapy and nursing services which were spread out around Bolton. So this brings all the nurses, therapists, consultants and relevant services in one site. At the same time, the diagnostic services provided by ICATS from Salford were also co-located here. In effect, nurses, doctors, therapists can nip in and out of each other's clinic rooms. We have access to all the medical records for these patients and also access to the Salford notes and systems as well, so seamless care to the patients is dramatically improved. We felt this would be a great benefit to the patients in that there's a one-stop shop, as it were, where they can ring in, speak to the relevant person and get a much quicker response to any of their needs, that they're confident in the service and that the service talks to different elements, and also that they know they're going to one place and they're comfortable with that.
The group has got involved through meeting regularly with the long-term care team and providing feedback to them from users and carers. So, for example, if patients have met a problem in trying to make an appointment for a clinic, then that would come through us and we'd have a chat to Janet and the team about it. And usually any issues we bring up are resolved as soon as it's practically possible to resolve them. So we have a good working relationship. I think as far as the patient's concerned, the benefits of being able to attend one centre for all the neurological clinical treatments is a great bonus. A lot of support information has been provided for patients to introduce them to the centre and the changes that have been made to their neurological care. They very much value the fact that they can make one phone call and through that phone call have access to a range of different therapists, specialist nurses, consultants, and that seems to be working really well.
So the original idea came by looking at the amount of demand and capacity we had within the department for producing orthotics, and we wanted to introduce a system that would enable a non-clinician to help with the manufacturing process of orthotics, and also a device that would last longer. So we were looking for a device that would last 3 to 5 years rather than perhaps 12 months, and that would also help us to increase our capacity because we wouldn't have so many people returning for appointments. Before the system that we've currently got now, it was a labour-intensive system that we had. It involved clinicians either sending in plaster of Paris moulds or foam boxes. We'd then have to have clinicians filling those with plaster of Paris to produce a positive model. That would then have to be modified before we could even start to begin to manufacture the orthotic to sit on top of the device, and that could take a number of days, if not a week or longer. The AMPIT system enables us to stand a patient on a scanning device with the foot in a certain position, and the machine will then scan that foot for us. The clinician can input the prescription that they want to onto the device, and the machine will then manufacture the insole within 15 to 20 minutes. So we have a 3D motion analysis laboratory within Ashton Primary Care Centre, and this is primarily used for people with very complex cases where a traditional biomechanical assessment is unable to identify the problem with gait. So we can refer people to motion analysis, and with a set of markers placed on at various anatomical positions, a person can walk across the force plates and in front of the cameras, and it'll produce a 3-dimensional model which the clinicians can then use to identify the problems and arrive at a diagnosis and treatment plan for the patient. One of the benefits that we've noticed is that 99% of patients referred to us now will be seen within 12 weeks. Prior to having this system, that was only 64%. It's also worth mentioning that actually prior to having this system, we had like 604 referrals into the service. In 2009, we had just under 1,300 people referred in. So not only are we seeing people within the 12 weeks, we're also seeing double the amount that we saw previously.
And the winner of the 2010 Service Improvement Award is East Lancashire Hospital's NHS Trust and their physiotherapy service. Well done to all those involved in this project. This now concludes this year's Health and Social Care Awards. I'd like to thank all of you for putting your time and energy into entering this year. Let me now hand you back over to Mike for a few final words.
Well, it's back to me again, and you've now seen all our finalists and you've seen our winners. All I've got to say is wow. I'm just so amazed every time I see the NHS in the kind of glory that we've seen it, with all those people committed to try and improve the lives of people in the North West. It's fabulous stuff. I have to say, as always, commiserations to those of you who were finalists who didn't win this time, and congratulations to those of you who actually won those awards. I just find it completely inspirational. It's just something that every time we show the best of the NHS, it reveals the passion, the dedication, the commitment of our staff. So thank you very much to all of those who took the trouble to apply. Congratulations to all of you, irrespective of whether you won. And let's hope next year we can say even more about the good things that are happening in the North West. Thank you.